rolling. Well, most of you who are here know a lot about what's going on as far as Medicaid expansion is concerned. So I will just give you the core of my hour-and-a-half long speech that I was asked to give tonight, and talk a little bit about some of the reasons why we should do everything we can to try to get our legislature to pass a clean Medicaid expansion bill. There are two bills that were introduced on the first day of this session of the legislature, one in the Senate and one in the House by good Democrats. Every Democrat in the legislature, I think, signed on to one of those two bills. Number 3 is the number of it in the House, and I think number 5 is the number of it in the Senate. And they're clean Medicaid expansion bills. They basically just say expand Medicaid, period. Now, the other side of the aisle has a bill as well. I don't know if it's been introduced yet, but 2 years ago it was introduced by our good friend from McDowell County, Josh Dobson, who is the Republican representative from McDowell County. And it is a fairly clean Medicaid expansion bill, but they require a couple of things of insureds in order to get the benefit. One is if they're able to pursue some work, and the other is to what they call put some skin in the game by paying some fees or premiums to get that benefit. So it probably will be introduced as a competing Medicaid expansion bill. So the question is, why should we be interested in seeing that this bill is passed in our legislature with as few impediments as possible? And the answer is very simple, because that's what the people want and it's what the people need. I told one of our representatives that if he looked at any poll that had been taken in the state of North Carolina in recent years about Medicaid expansion, he will see that just about every one of them say that most of the people in our state favor Medicaid expansion. And certainly people need that. Medicaid, as you know, is coverage for people who are on the bottom of our income categories. We have some of those folks covered already, but the Medicaid expansion tries to take care of the ones who are not covered. Not everyone will be covered even under Medicaid expansion. There are some long-term long-term medical conditions that are not covered under Medicaid and probably will not be for a while, but we can work on those once we get the basic bill passed. That is long-term, mostly long-term care for mental health, for example, and that kind of thing. Now, the question is, if it's good for North Carolina, is it good for Burke County? And the answer is absolutely, it's good for Burke County. The Kate B. Reynolds Charitable Trust, which is a very respectable organization, put out a study back in 2014 when Medicaid expansion was early in its consideration, and has a page of statistics for each county in North Carolina as to what the possible benefits might be for having Medicaid expansion, and they're essentially the same. It gives coverage to people who need it. It creates jobs. It brings revenue to the county, and it cuts the cost of long-term care. If people go to the doctor on a regular basis and they have insurance to cover doctor's visits and things like that, they're going to live longer, have better outcomes. And so that's one of the reasons that we want to get it for Burke County, because it will be a benefit to us. Now, the other side also has a document out on the internet right now of the reasons why we should not have Medicaid expansion. And I could go through here and refute every one of these, but basically they say it's just like trickle-down economics, and it doesn't work. So you can find that on the internet and read that. But to drive the point home as to why we need Medicaid expansion for the least of our citizens, I found a story in this book that I picked up this week, and they're talking about medical care, and they interviewed some doctors in various regions of North Carolina. And this particular doctor is in Kinston, North Carolina, in Lenoir County, and he talks about the experiences he has had in treating people who are unable to get insurance and how much it would help for them to have it. And he tells this one story that I think is very telling, very important to our consideration of why we should expand Medicaid. He says, the failure to expand Medicaid, he reports, has had a devastating impact on his low-income, uninsured patients. The most wrenching of those consequences occurred last year, he says, when one of his patients, who made about $10,000 a year, working at a local diner, faced severe dangers of heart failure from a troubling genetic abnormality. The doctor had treated her initially in the emergency room at Lenoir Memorial Hospital. He was able to stabilize her, send her home, but her heart remained very weak. She was in her early 60s. Her sister had died from the same malady. She needed a defibrillator, which for an uninsured patient could cost up to $80,000. Of course, she couldn't get the money on the open market because she didn't have enough money for insurance. She couldn't qualify for subsidies under the Affordable Care Act, that's Obamacare. Astonishing, because she was too poor. The program's cutoff was above her pay level, and so the doctor saw her for several months, but he was unable to secure a defibrillator for her, and as a result, this waitress making $10,000 a year passed away. So that's one of the reasons that we support the expansion of Medicaid in North Carolina.